Those of you who don't know me, my name is John Gallagher, and I'm the current chair of the Pennsylvania Medical Society Board of Trustees. This is another portion in our ongoing attempts to increase member engagement and reach out to get input from all of our members across the state. This program started about 2 years ago with our previous chair, Dr. Talenti, who was committed to increasing the amount of transparency as we communicate with our members. Since I've taken over the board, I've tried to do the same thing, and we're continuing this year as our new president, Dr. Denai Powers, with her presidential initiatives, has tried to get this word out as well, so we can increase all member engagement everywhere throughout the Commonwealth. So we're going to try this tonight. I appreciate your input to see how we do, and this could be something we continue, or this may be a one-shot deal. We did do several town halls in the fall, where we did live CME and the town hall presentation, which seemed to be well received. We usually average about 50 members at each of those sessions, and we got a nice response at that time. We did notice that most of the people at those meetings had a lot of gray hair, like myself, and we really weren't reaching out to younger people. So we thought we'd try doing a webinar at an off hour to see if this would improve reception. And we did get 20 members signing on tonight, so we'll see how it goes. In terms of housekeeping, at the end of the session, we will be accepting your questions through the question and answer screen located at the bottom of the Zoom webinar panel. We will not be using the raise hand feature tonight because technically it's just too difficult at this point. Next. This is the page you'll see when you're trying to go. At the bottom of the page is the question and answers. So if you pull that up, you'll be able to insert your question, and theoretically it will show up to me, and I'll do my best to answer the questions. Some of our members were good enough to send questions when they registered, so we'll start with those and go from there. So just an overview. Who are we? Pennsylvania Medical Society is the largest statewide organization for physicians. We have 10,000 members this year, representing members of all specialties and both all types of employment, privately employed and private practitioners as well. We represent about 1/5 of all the physicians in the state. So many other physicians benefit from our actions and activities, and we're trying to reach that to increase our membership at all times. We are focused on key issues that affect the way you practice medicine. There are many things we can deal with, but these are the ones that you see day to day that we are most focused on at this point. Next. Our focus is for 2019 is membership development. As I said, last year, we stopped a trend that had been going on for several years in medical societies across the country, as well as in other organizations, of membership falling. We stabilized and actually increased our membership last year with large increases in young physicians and other physicians at all levels. So we hope to retain these physicians while increasing our penetration through those who have not yet joined the society over this year. Advocacy, and when physicians are polled, the most important thing they want to see from the medical society is advocacy. We advocate on the state level with the legislature, working on both legislation as well as rule implementation with the different departments within the state government. We are focusing on the state level. Many of our counties are integral members in their local communities. A recent example was that Philadelphia was able to at least temporarily stop a bill that was going to limit the way physicians could practice medicine in prescribing opioids. This is the type of thing that, as our counties are doing it, if we can help them, we're glad to do it, but they will be looking at most of the local issues while we work on the state level. And then outreach. That's the other thing, as we said today, we're trying to go across to all members of our society. As we'll see later, our House of Delegates meets annually to set our policy, but they represent only 1% of the physicians who are members of the medical society. So we're trying to get input from everyone else to see if we can make better membership value for all of our members. We're hoping one of the resolutions that came up in the last House was to allow us to do virtual town halls or virtual House of Delegates over the course of the year, so we would not have to focus all of our policy-making decisions in the House once a year. So keep an eye out. We hope to be able to make some changes over the next year in further outreach. Next. What were the wins that we had? Annually, in each 2-year session of the legislature, there are hundreds of bills that are entered that affect medicine in one way or the other. Our job is to try and get the things that will help medicine and our patients to pass, but stop the things that can be harmful to us at the same time. In the past session, we're able to stop the CRMP independent practice legislation and other scope expansions. This has been an ongoing battle for the past several years, and we'll talk about this later. We'll continue in the next legislative session as well, but nothing proceeded to a final vote in the House this year. We're also able to stop some of the mandatory prescribing guidelines that had been proposed, and we'll come back to talk that in a couple of minutes. Next. One of our initiatives last year was prior authorization. We have heard from physicians for the past several years that prior authorization is the greatest bane to their existence. Both the time they have to spend on the phone or on the computer trying to get authorization, as well as the time involved by the staff. The average physician spends probably 4 to 5 hours a week doing prior authorization. We were able to get a bill entered last year, House Bill 1293, which aimed to improve the prior authorization process by standardizing it across all the providers. We do our awareness to the legislature, and we made good progress. We sent out several requests to our membership across the state to send us letters. What we had hoped to do is provide stories to the legislators of the members of their citizens in their own district who have been affected by these problems with prior authorization. In spite of our efforts, we had a limited response to this, which is disappointing. It's very hard to go to the legislature and show what a problem it is if our members aren't supporting it. With the new legislation, we will have to start everything from scratch again, but we'll be working on this as probably one of our priorities. Next. Opioids. In the last session, there were at least 40 different bills that applied to opioids. That's over, and at this point, 15 Pennsylvanians die a day. Every legislator would like to have a bill with his name on it that shows how he's doing something to solve the opioid problem. One of the bills that was proposed was to mandate the voluntary prescribing guidelines, practice guidelines that we've worked with the Department of Health over time. We strongly believe these are very good guidelines, but they should not be mandatory because there are certain instances in every individual case that individual medicine must be available. We were able to stop this over the past year. We also advocate to remove barriers to treatment. We've seen this by the decrease in the prior authorization on Medicaid and the insurers all across the state agreeing with the governor to remove prior authorization for medication-assisted treatment. We advocate for bills that do not infringe on physicians' ability to address the individual needs of their patients, as we said. One of the bills that came up was for mandatory electronic prescribing of opioids. Although many members will feel this is a great way to go, electronic prescribing is not available to everybody, especially in the rural communities where they may not have any electronic health record, or they may not have high-speed access that allows them to use this. So we were able to work with the author of the bill to put in conditions that there are reasons that physicians will not have to use the electronic prescribing if they meet these conditions. Next. The opioids, again, we call that the inflexible mandates, and we were successful in blocking Senate Bill 655 this year. As part of our advocacy campaign, we went around to legislators and gave out caduceus-shaped cookie cutters to show that we were trying to oppose cookie cutter approach to medicine. It may sound like it's a stupid idea, but our legislators look at this as something to remember, and it hits home with them, and we were successful with our opposition. Next. Other advocacy priorities that we had in 2018, telemedicine, which we've been working on for several years. We had a bill got into the House, and we got it through the Senate, and we almost got it to the House. At the very end, it looked like we were finally going to get voted on this bill. We were thrilled about this, but the last minute, up to 20 amendments were placed. One of those amendments was going to prohibit telemedicine use for abortion treatments, which was a poison pill for some of the legislators, and so it got stopped at that point. We'll probably be looking at this again early in the next session because there's a lot of support in the House for this. Drug formularies, our House has told us that physicians cannot stand the fact that they try to prescribe medications and then find out afterwards it's not covered on a formulary because the formulary is too narrow and that they don't have access to what other medications can be used in place of this. So we are proposing legislation that will mandate that the insurance companies provide greater access to physicians to other choices of medications within their formularies. Informed consent, as many of you know, last year the Supreme Court upheld very strict requirements on who can obtain consent for surgical procedures, blood transfusion, and chemotherapy infusion. These restrictions made the practice of medicine much more difficult, especially in the teaching programs, but also in private practice, where physicians who work with partners could not get approval, prior authorization, consent before surgery, unless they were doing the surgery themselves. We have worked with the Hospital Association of Pennsylvania, and we have developed a bill that we will be introducing into the legislature this year to try and correct this problem. Maintenance of certification. The Pennsylvania Medical Society has been at the lead in the national fight against maintenance of certification. We strongly believe that continuing education is essential to physician care, and we support this. We find maintenance of certification to be overbearing in many cases, expensive, and needless. Some specialties are very happy with their programs, others aren't. We're trying to find the middle ground. The American Board of Medical Specialties formed a committee last year to look at overall maintenance of certification and make recommendations. We were fortunate to get one of our past presidents, Charles Cutler, onto this committee, and they have provided a report that we have posted in the Daily Dose for the past several weeks. This report has several ideas on how to improve or change maintenance certification. Until January 15th, the Commission is accepting ideas or comments on their report. We are encouraging all of our members to send their own personal stories and their opinions of these changes. The Medical Society itself will be using their continuing education program, continuing professional education committee to form a response, which we will be sending out next week. We also have approved pursuing legislation in the House over the next session to prevent maintenance of certification for being used as a condition of credentialing either with insurance companies or with hospitals. We are not approaching licensure as other states are, because in Pennsylvania you do not need licensure, maintenance of certification to have licensure, and we really don't want to raise this issue that somebody might decide they want to go in that direction. So, next. 2019 PAMED Advocacy Priorities, I cannot tell you what they are yet. They're in process at this point. The way we're approaching the 2019 legislative session is we have sent out a questionnaire to all of our members and are collecting those responses now on what their priorities should be for our advocacy issues. Once we get these results back, we will hand these to our task force on legislative advocacy, which is chaired by Michael Della Vecchia, our new vice president, who will then make a report to the board in February. And at that point, we will decide which of the main advocacy priorities we want to pursue. We would love to pursue everything that's important to us in medicine, but the problem is we don't have all the resources available to us, so we have to limit our resources, and we have to prioritize what we want to spend the most time dealing with. The other things we will favor, but these are the things we will put the most work into. One of the things that you can be sure will be on the next legislative priority is the proposed venue changes. This was one of the questions that was sent in advance. Let's review this for a little while. Several years ago, one of the greatest successes that the Medical Society had was that we were able to get Act 13 passed through the legislature. This was a major tort reform that included many sections, but this also included pre-trial certification that stopped some of the needless cases from going forward, and it limited venue shopping. Venue shopping was the process where a plaintiff's lawyer could try and move a case into one of the larger jurisdictions, such as Philadelphia, where the cases had a better chance of having victory, as well as having much higher malpractice awards. Once the legislature passed the bill, the Civil Procedures Rules Committee at that time changed it and followed the legislative mandate at that point. Subsequent to that time, a case was filed against the legislature that the rules that they had passed were unconstitutional because of an infringement by the legislature into the judiciary power of the Commonwealth. This made it to Superior Court. The Superior Court ruled that the law was, in effect, unconstitutional. However, they did rule that because the CPRC, I'll have to keep looking at it because I can't remember that name, had already implemented the changes, the case was moot and the case stopped at that point. However, now for reasons of their own accord, probably related to the Bar Association, the CPRC has decided to change these rules. What's happened since the implementation of Act 13 is there's been a major decrease in the number of malpractice cases across the state. There's been a gradual increase in the payments per award, but the total number of cases have gone down markedly. The CPRC feels now that patients are suffering because they are not getting the awards that they should be worth getting, and they are trying to change this rule. We are trying to act on this, and at the current time, we have sent out advisories asking everybody to send a letter to the CPRC showing the importance to your practice and to your patients of not changing these venue rules at this point. If adopted, as we said, we can anticipate higher medical professional liability premiums, as well as companies pulling out of the state as they did during the last liability crisis. In addition, less physicians will want to come to the state because it will become another red zone for malpractice, and we'll see physicians probably retiring earlier, which will only increase the problems with medical access. Next slide. So what can you do at this point? We are doing everything we can. We are calling a meeting next Monday for leadership of county societies, specialties, and other medical organizations, as well as other stakeholders such as the Osteopathic Association, the Chamber of Commerce, the insurance companies, who all have a vested interest in this law, and we're pulling them together to strategize how we can best approach this problem. In the meantime, our best opportunity is to deluge the CPRC with letters. We have all the information on our webpage under the liability section. You'll also see a draft letter that I sent to Carla Schultz, the council, that you can use as a template. Make your own letters as you want to, but the information is all included in there for you. They are accepting comments until February 22nd. We do not know how long after this things will happen. In addition, if they do make this change, our follow-up options are going to be somewhat limited. Since the legislature has already been found to have the bill unconstitutional, it would mean restarting the process. The eventual decision was made by the Supreme Court, who actually oversees the CPRC, so they're already supporting that mechanism. The alternative will be to get a constitutional amendment, which in Pennsylvania requires legislation to pass both houses of the legislature in 2 consecutive sessions, followed by a ballot initiative that has to be passed across the state. That's why we had problems in the past with caps on tort, and that's why we'd have a major challenge going forward. So we need to act now before it's too late. One of the questions we got was the resolution at the House of Delegates. As everyone knows, the House of Delegates meets once a year, and they are the policy-making body of the medical society. What they decide, the board is charged to implement over that next year. When things like the venue change come up now, where the House of Delegates will not be meeting, the board has the opportunity to make policy in the interim to be reviewed by the House at the following session. At the House of Delegates website, we will be posting regularly the progress on the 2018 resolutions. In the past, all House of Delegates received a quarterly report on the update on the resolutions. At the recommendation of our president, Dr. Powers, as a part of our initiatives, this will be continued on the website at all times with a monthly update so you know what is going on. Also on the site, if you go to the resolutions, if there's a subject that you're interested in, you will be able to get involved in the process. If there are committees for further input, we will be utilizing those names that have volunteered to be part of the process. We're doing everything we can to get more people involved across the board. I will let everyone know that in January, when Dr. Wilson, my vice chair, and myself made committee appointments, we sent out requests across the state for volunteers to serve on committees. We received about 4 nominations from counties across the state. So we want to try and get more people involved. We need your help. If you're willing to do so, we'll come back to other ways you can do that later. But on the site, you can register. Yeah. I think on the next slide, we show this slide. Go ahead, next. Yep. Once you go to the website, you'll see what the resolution is, and you can fill out some information. So our background, I know how to contact you and what you can do to get involved in this process. Next slide. Okay. So next, for 2019, okay, we want to make this your year of learning. Outreach, as we said, the telephone town hall that we're trying tonight, if this is successful, we could try and do these on a regular basis throughout the year. We can also do on other topics, including our CCC or other things that our members may be most interested in. We have started a virtual leadership journal club. This started last year. This is an offshoot of our leadership development program that allows members to gain CME and credit toward a master's in business, an MBA. So we have now started a leadership club. So every month, the members who wish to participate will receive an article, do online discussion of the article, then have a phone call to discuss the article and how it relates to medicine and leadership opportunities. We will continue to have our practice administrator meetings. The next one is scheduled for the spring on April 17th. We'll also do one in the fall. These have been well received by office managers across the state. We will be doing those in some focal areas and online as well. These will deal with new rules and regulations, coding changes, things that are important to the functioning of our offices. We're also going to have our second Foundation Resiliency Summit. Approximately 2 to 3 years ago, the foundation did their first burnout seminar, and we're going to try and repeat something similar at this point. Burnout is a problem that affects up to 50% of physicians in America. The highest group is between 35 and 55 male physicians. We need to have these physicians stay active and stay in practice, and so we're going to be working on that to try and find ways to solve this problem. And finally, we're going to be doing a physicians legal conference September 13th to 14th. This is just save the date. We're in the process of organizing this now. Several members have asked for this type of meeting in the past. We'll be dealing with legal issues that face you on a daily basis. We'll probably be doing this with the Bar Association, and we'll bring in experts on different subjects to have that. We anticipate that being in Harrisburg in the fall. Next. Connection points. As we said, with our attempts to reach out to our members and get the information out there, we have started the Ask the Chair site on our portal. So anybody that has a question at all can ask the question, and we will get an answer to them. The ones that seem to have the best or the most input effect on everyone across the state will probably publish the answers in the dose as well. The Board of Trustees. The Board of Trustees is made of about 35 active members, both specialty representatives and regional representatives, who are your representatives. We have encouraged them to go to county medical society meetings, to go to specialty meetings. If you don't know who your Board of Trustee member is, call the Knowledge Center and we can let you know and put you in touch with them. They are your source of information, and they are your other access point that you can send that information back to the board regarding your concerns or things you'd like to see done. The PA Knowledge Center can be reached both by phone or by email. This is your main entryway into the medical society. Those people don't have the answers to every question, but they do know who to send things to, who to forward to, and who the experts are in each field. So on any question whatsoever regarding your practice, your problems with patients, legal quandaries, anything, if you contact them, they will direct you to the right person to try and help you. Every Thursday, we send out the dose. We used to do this twice a week, but some members felt there was too much, bit of overkill on electronic transmission. So we're trying to cut down. That is once a week. It's sent to all members. If you're not getting it, if you call the Knowledge Center, they will make sure that you are put on the mailing list if you've been missed somehow. In this, you will also find the things about the calls to action that we send out as we did with the venue problem. And social media. We encourage you to follow us on Facebook, Twitter, LinkedIn, and Instagram. In the past year, we've seen our social media hits go to over 2 million from below 1 million prior. So in 1 year, we've had 1 million increases in social media hits. We believe this probably played a role with some of the membership, as we're seeing much more of our young physicians taking part online at this point too. So if you'd like to be a social media follower, if you contact the Knowledge Center, they'll put you in contact with Jeff Wyrick, who can guide you to getting this started. Next, the art of medicine. The video that you saw at the beginning of the presentation was the latest in our series that tries to bring back some of the joy to the practice of medicine. Every day we're all overwhelmed with electronic health records, billing problems, prior authorizations. We want to get back to the enjoyment that brought you to medicine in the first place. This is a campaign that we started last year. It has been very well received. The videos are posted and you can get them on YouTube. Feel free to send them to other people. They are very good and they're a great way to get our message out to the general public. Next. Finally, thank you for your membership. You know, you are the medical society. We serve you. Our numbers are up. We want to keep them up. Renew your membership early so we don't have to keep chasing all through the year so we can make progress. And you can do that online at any time. Next. Okay. And that is our presentation to date. So what I'd like to do now is try and go into some of the questions. We probably won't get to all of them, because you may have noticed in the background, I am in my, what used to be my library is now my grandson's bedroom. So I will have a limit at the end here, but we'll try and get through as many questions as we can. And in the meantime, if you want to post your questions on the question and answer site, if we have time, we'll go to those as well. The first question we had is from Dr. Dende on the update on tort reform. I think we've covered that pretty well, so we'll skip over that at this point. Next question from Dr. Cavalli. In what concrete manner can PAMED Board show its capability to support out-of-the-box ideas? Well, it's interesting that came from Dr. Cavalli because he's going to be involved in this directly. Several years ago, we sold one of our subsidiaries, KeyPro, for an amount of money that has helped fund the organization. This money was put in a special purpose fund, and the board has decided that it would be devoted to 3 buckets. The first bucket was to maintain the foundation, because KeyPro had been a big supporter and financial contributor to the foundation and wanted to make sure this wasn't lost. So that will continue indefinitely. The second bucket was the advocacy bucket, where we would be able to reach at times of need to pull from there. The venue reform is probably something we're going to tap that bucket for at this point, because this is something that came up and is going to need a lot of work and will cost some money to make progress on that. The third bucket was the innovation fund. What we wanted to do is start use some of the money to fund out-of-the-box ideas that would help physicians, practices, patients, frankly, going forward. The intention was that this would be seed money to get people started. It would not be long-term funding, but we thought this could get some ideas started throughout the Commonwealth. We announced at the House of Delegates that we finally have this in place, and this will be starting. The committee has been formed that is chaired at this point by Dr. Ted Christopher, our immediate past president, who is integral in developing this innovation panel. The panel consists of members, professionals, people, because what they will need to do is put out the request for proposals, review the proposals that come in, and submit them to the board. They will prioritize which ones they think are the best. The KeyPro committee will look at the funding each year to see what is allowed that we can take down that will not harm the endowment itself, and that's the money that we'll try to distribute as needed. Dr. Gavalli, who wrote the question, is one of the members who will be asked to be on this because he has such a strong interest in this field. So I think we'll make progress. We anticipate doing the first request for proposals in February so that at the May meeting, the board can decide and put out the first grants by June. We will then get back on the plan schedule that each fall the House of Delegates will put out the request. And by January, the requests will be received. The board can review them, fund them, and after January, those will go for the year. So there'll be more information coming up on that. I think that's a great idea, and I think everybody will be quite happy with this progress. Next question. Question from Dr. Westcott on the ACP Scope of Practice. No question, but ACP Scope of Practice. Let me summarize where we are with this. The policy of the Pennsylvania Medical Society is that medicine should be a team project with the physician as the head of that team. Nobody should usurp the physician. Independent practice should not be allowed for any advanced clinical practitioner, whether a physician assistant, nurse practitioner, or nurse anesthetist. This has been our position all along. We have proposed that, and there was no wiggle room with this at this point. For the past 5 years, the nurse practitioners have been trying to get scope of practice changed so they could have independent practice. They've done very well. Each year, they've been able to get their bill through the Senate by a pretty unanimous vote, something like only 5 dissensions out of the Senate. Where we have been able to do well is we've been able to stop it in the House. Okay? Many other House people, we've met with them over and over again, and they support the position as being in charge. Our leading proponent was Representative Mustio, who was the head of the Professional Licensure Committee. He was able to keep this bottled up for several years, and last year was the strongest factor in keeping this from being advanced to the floor of the House. Unfortunately, Representative Mustio has now stepped down, being replaced by Representative Kathy Rapp. This bill will come up again. The nurse practitioners are committed to this, and this will go forward, so we fight this battle again. We will continue fighting. I will let you know that it's getting more and more difficult at the House level, because once we get out of the Professional Licensure Committee, it's very difficult to know which way the House is going. There's a lot of support for this bill. So we'll be working. This will probably be one of our prime advocacy issues again. We'll be doing our best to stop it all the way through. Question from Dr. Murdoch. Sustainability of primary care and how the CIN is working on advanced practice models, association health plans, and direct patient care, direct primary care. Dr. Murdoch is one of our experts on this, especially with direct primary care. He had a resolution at the House, I believe 2 years ago, that resulted in a white paper being formed that's currently on our website and will be there for quite a while to help people who are thinking about going into direct primary care as a method of practice, to guide them there. He knows much more about that than I do, and I would refer you to the white paper on that subject. In terms of the advanced practice models, this is something we're fighting with all the time. This is my weakest spot when it comes to practice models, whether it's MIPS, the other things going on. Fortunately, what we have developed at the request of the House is our care-centered collaborative, which was the offset of our practice option initiative, passed unanimously by the House about 2 years ago. This organization is designed to try and set up clinically integrated networks across the state and working with primary care and specialty, as well as insurers, to provide the best care for patients in an alternative payment model. Right now, as of the House at least, they had 150 practices signed up, or physicians signed up, and there are many others in the line now that we're hoping to get going with this. Information on the CCC is available at patientccc.com, and Dr. Sidoroff is the chair of that, is the president, the EVP of the organization. He has been traveling across the state to counties and other organizations, spreading the knowledge, trying to get more membership involved at this, doing an excellent job at this point, and we hope this is going to be a transition year for the CCC. He is going to be doing a similar webinar probably over the next month or two. I keep my eyes out, and he will be able to give you much more information about the CCC and the alternative practice methods. The association health plans. This was an issue that came up at the House. Association health plans are, I guess, a safe harbor where individual practices and groups through the specialized groups can form plans to provide health care, usually in conjunction with an insurer. This is being pushed by the administration in Washington, but the administration in Pennsylvania has been fighting it tooth and nail. The Department of Insurance has said they do not favor association health plans at this point, and are not making any progress on this. The Attorney General has filed suit to stop association health plans in Pennsylvania. The health plans have to be done in conjunction with insurers. As long as the Attorney General has filed the lawsuit, they will not take any action on this as well. So this is, at this point, a standstill. The medical side is looking at this, because this could be something that could be beneficial to our members in the future if the environment changes. But right now in Pennsylvania, we don't see a road forward for association health plans. But stay tuned, that could change at any time. A question from Dr. Rahmanian. Can we lobby the state to make PAMED membership a requirement for licensing, since PAMED represents the physician? Nothing would make me happier. If there was some way we could mandate that physicians have to be members of the medical society for licensure, we would be a very strong, powerful organization with even greater resources than we have now. That's not going to happen in Pennsylvania. Pennsylvania legislature fights against all union activities, anything like that, anything that would compromise individual activities. So that is probably a non-starter at this point. Dr. Colleen Carignan asked a question about mbps as an option to MOC. As we discussed before, we're very active in MOC. We are not taking any particular stance on any organization right now. We're looking at all these. We want to find the best way to resolve the issues with MOC, all specialties across the country, to make it something that will be applicable within Pennsylvania as well. I will tell you that my own hospital has accepted MPS as a reasonable alternative. And so at your staff level, you may want to look at this. But right now, it is an option that's out there. But we're not taking a aggressive look in either direction right now. Staying neutral on that point. From Dave McKagan, follow up on Resolution 2018 from the House of Delegates, which talks about the relationship between the counties and the state. We are actively working on this now. The counties have started a group that is now working with the state as well to develop a strategic plan that we can work with the states, with the county organizations for the betterment of our society. We also have a separate committee that will be made of members of the board, non-members, and county executives to look at this. Over the next several months, we're going to try and find the best way forward to maintain the good relationship between counties and states. In the past, there's been some problems, but many of the people advocate for major changes there are no longer around. We think that we agree that the counties are integral to the function of the medical society. We have to find the best way to make all of our counties viable. What is the difference between the Political Action Committee and PAMED? Interesting question, because as I reviewed for the session tonight, we look at everything that we want to do. Scope of practice issues, prior authorization requires working with the legislature. It is essential that we support those legislators who support us and we oppose those who do not. That is what the Political Action Committee does. The medical society cannot support specific candidates. We can support issues only. PAMPAC cannot support issues. They can only support candidates. On the call tonight, there are about 20 physicians. Greater than half of the members on this phone call tonight are not members of PAMPAC. So you are members who are willing to come and participate, but we need you to participate in PAMPAC as well. It's critical that you do this, especially early in the year. You can do this by joining PAMPAC online at our website. There's a link on the homepage. You can also go to pampac.org. We appreciate your joining at any level you can. Obviously, the higher the better, because it helps us. Any level will help us. When we go to meet legislators, they want to know how many of our people are engaged, and we're not even close to the trial bar when it comes to engagement on the political action front. That is about the only questions I have that have been advanced. Are there other questions that have been submitted tonight? I don't see any. Does anybody have any questions I'd like to type in at this point? Well, I'm not seeing any. So I thank you for your time tonight. I hope this has been of some help. If it has, please let us know. Please let us know how we can improve it for the future. If you think it is not valuable at all, also please let us know, because we'll continue to look at other ways to provide engagement for our members. As I said before, I thank you for your membership. I thank you for your support. And I hope that you can keep going all year long. And keep an eye out for the regional meetings, because I'd love to see more out there too as well. Thank you, everyone.